This is what I get a lot of this time of year, but this year, 2015, I'm thinking this probably is going to be the year of the red-eared slider for me. I'm just getting slammed with them. It's about every day I'm getting a call, and a lot of times I'm getting multiple calls at the same time. I was just dealing with 2 cases at the same time, and that's pretty common this time of year. One turtle, the people turned around and went back for it. They didn't know about me at the time. Then they learned about me later on after doing some searching and went back for the turtle. It wasn't there. This one was brought home right away by the people that found it. And that's what I advocate, is that if you do find an injured turtle, go ahead and bring it home. Don't notify me of where it is, and then in hopes that maybe I'm going to be able to go out there and find it later. Just go ahead and grab it as you see it, so it's not hit again, or a predator doesn't get it or something like that. But so she was hit by a car, obviously, and she has a fracture all the way across the bottom of her plastron here. And the really bad part is it fractured her bridge right here where the skin meets the shell. That's really bad if that gets torn there, because then that's a breach of their ability to be watertight. And if they go back in the water like that, they'll end up having a water intrusion, and then water will fill their lung field, where their lungs can't expand when they do come to the surface to take a breath, and so they don't actually drown. What ends up happening is they suffocate, because their lungs won't expand because water's gotten into this cavity. And if they don't succumb to that, then they end up getting sepsis and dying of an infection later because of the dirty water. But she's cracked there, and then all the way along the bottom of the bridge, all the way to up here, and it's cracked here. And I've already reset. There was a little triangular piece of bone here that was out of place, and I've already reset that. I have some little sculpting tools that I use that have different ends on them, which come in pretty handy to stick inside the fractures. And because this is pretty hard work because of the tension from the connective tissue on the backside of the bone to reset these things in place. A lot of times it requires using a little bit of force, like here, trying to reset these pieces. She's had some anesthetic for the pain before doing this, but in this case, these wounds this is fairly fresh. This just happened, and in these cases, I found, rather than cleaning this all off with chlorhexidine or something like that, and cleaning it all up like I used to do, I found that if the wounds are very fresh and they're bleeding, especially for the water turtles, it's better for them if they are bleeding, and to just go ahead and reset the fractures as best you can then, without cleaning the wounds all up. What I'll do is I'll put her on some antibiotics later, just in case, as a preventative against infection. But the bleeding is a good thing, and I used to clean the wounds and stop the bleeding and all that, and I found that actually it's better to go ahead and let it bleed and to reset the fractures, and that actually aids in the bone healing, and where there may be the gaps big, it aids in the scar tissue backfilling in the voids a lot better than if you were to just go ahead and clean all the blood away and disinfect the wound and everything. So as long as there's no obvious debris, contamination in the wound, or it's not an older wound that appears to have been infected, then if they're bleeding, I will just go ahead and let it bleed, within reason. If they're hemorrhaging to death, then I'll intervene. But if it's just small bleeds like this, I'll go ahead and let it bleed and reset the shell, and then stabilize it either with tape or vet wrap, or with some anchors and some zip ties, or orthodontic fixtures and surgical wire, however I need to do it. The blood brings all the cells into the area that's going to backfill this, the calcium, the calcium phosphate, the cells that are going to fight the infection, that are going to oxygenate the area, your red cells and your white cells, and everything that's going to rebuild this. That all comes by way of the blood. Right here, though, she's got a bit of a gap that's not wanting to go back right into place. What I'm going to have to do with that is take some vet wrap and wrap her shell all the way around really tightly to put some tension on that to maybe draw that back up. But let's see what our other side here. And this isn't too bad. I can try to stabilize that a little bit, but mainly what's going to come in on that is scar tissue is going to build back up over that, toughen that up. But that's going to take a while. She's going to be dry docked for a while. She won't be able to go in the water with these kinds of injuries. So she's going to be drinking from a shallow dish for a while. But actually, all things considered, she's not as bad as most of them I've been getting in lately. She's got pretty good chances. Yay me! Another turtle. I'll probably be keeping overwintering. She probably won't be release ready until next spring. So, okay. Find my page at facebook.com/reptile rescue. Thank you. After I've went ahead and used all my little instruments here to reset her fractures, the bone back in place as best I could, and here for this big one across the plastering and the bridge, I put some big heavy-duty medical tape across that. That's holding that together pretty well. And down here I've used some dental restorative. This is called glass ionomer, and so it's sort of a glass ceramic composite, and I've taken all those broken pieces, and she's pretty lucky that she appears to not have suffered any perforation of her internal membranes, exposing her internal organs, that's very good, and really little missing bone, very little missing bone. A lot of times they're pretty much doomed if they have a chunk of bone which is ripped away and it takes a tissue with it and opens up their body cavity. And in this case, she pretty well has most of her bone still attached, still in good order and fit together pretty good, like puzzle pieces going back together, and still connective tissue to it, providing blood flow, so it's still viable and everything. And so just in a few places I place some of this glass ionomer, and that's dried, and as you can see, that's pretty well stabilized. So she's probably going to heal back together nicely, but this is going to take a little bit of time. She's going to be dry docked for a few months, And that's going to be kind of hard on her, being that she's a water turtle, but her chances are actually pretty good. There's her little face. And she's a very good patient too. Of course, but she was like this even before she got her anesthetic. But she's a really good patient. A lot of these red-eared sliders, especially the females, they tend to be very bitey, and especially if they're injured. And usually I'm trying to work on them, and they're trying to crane their neck out and bite me everything that I'm doing. So she's been a very good patient because she hasn't tried not once to bite me.